We're going to help you get feeling better this morning. If you're in need of physical therapy, why not think about aquatic therapy? So glad to have Becky Geren here from CHI Memorial at both. Are you at both the Hamilton Place and the North River locations?
I'm currently just at the Hickson location.
At the Hickson location. So this is really interesting to me, and I'm sorry that I'm late in the game. I did not realize that when you go to the Hamilton Place Y or the North River Y, in-house there is a physical therapy office for CHI Memorial.
At the Hamilton Y, that is the case. At the North River YMCA, we utilize their aquatic area for our physical therapy.
And the straight physical therapy is at the hospital there in Hickson.
Yes.
Okay, I got it. So let's talk about aquatic therapy, because many of us are accustomed to seeing maybe at a physical therapy office, they have that little pool, that tiny little, almost like a whirlpool looking thing.
Right.
This is entirely different what you do.
It is. We utilize the space at the North River YMCA and at the Hamilton Y. There are pools there, and we are able to get in the water with our patients. That way we can be hands-on, we can individualize the program, we can modify as needed during the course of each treatment session or throughout multiple treatment sessions.
You hear people talk sometimes about how painful physical therapy can be. That you hear that, I'm sure.
Yes.
This is aimed to prevent that from happening, right? Because if you have, is it mainly joint issues that cause someone?
A lot of joint issues limit people's ability to perform maybe some upright activity, some weight-bearing activity, and we can attempt to improve their tolerance of exercise by using the properties of aquatics.
So how long is a session?
Generally, we schedule for a 60-minute session.
Okay.
But we can give or take on that as the patient needs.
You can't just call up today and say, hey, I saw you on 3+U, can I do aquatic therapy?
Sure you can.
Well, but don't you have to make the phone call? But don't you have to evaluate them first to make sure that that's the right course of action?
Yes. So because this is skilled physical therapy intervention, each individual will receive a individualized treatment plan after being evaluated by a physical therapist.
Okay.
And then we will discuss with that patient if aquatics is appropriate for their plan, and then move forward with that as appropriate.
Okay, so you're there in the water. You've gotten approved. This is the right course of action. You're in the water.
Yes.
For an hour, that's a long time.
It is a long time.
Are people tired when they get out?
People are tired. People will come back and say, I didn't realize how hard I worked yesterday. So yes.
So with you watching there, I guess you stay in the shallow end primarily?
Primarily, we do. We have full access to the pool, so usually between 3.5 to 5 foot deep in the therapy pool.
Something else that's really great is you told me it's closed off, so that when you're in the pool, it's just you.
Yes, just you and your therapist. So it's individualized. Don't need to be able to swim. You don't need to have any previous water experience. So we're in there with you to kind of help guide you as needed.
So what is it that you look for in evaluating someone to decide that yes, aquatic therapy is better for you than traditional therapy?
Generally, it's patients that have some sort of chronic pain that again is limiting their standing tolerance, walking tolerance, or just general exercise tolerance. Also, we like to utilize aquatics for folks that may have some balance impairment that might be limiting their mobility. We can get them into the pool setting, and they hopefully can reduce their fear of falling in that area by using the properties of the water again to help.
You use the word fear. If you've had some kind of an accident and you hurt, even in trusting hands, you're afraid to go through that physical therapy. Does this help minimize that for people?
I do think so. I think getting folks in this environment, it's warm water, there's some relaxation benefits as well. I do think that individuals are able to progress themselves a little bit quicker with this intervention.
Typically, is the aquatic therapy its own therapy, or do you use it as a means to then get them onto a more traditional path?
We like to use it as a means to get them to a more traditional path. We do not live in water, unfortunately. So we do like to hopefully progress individuals back into the clinic or to an independent aquatic exercise program when they're finished with their physical therapy.
You wanted to stress too that this is not the same thing as taking a water aerobics class.
Absolutely. This is one-on-one individualized therapy provided by a skilled physical therapist or physical therapist assistant, again, so we can modify and progress each program appropriate for each patient.
So your therapists, are they certified specifically in aquatic therapy? Is it a different means of being trained?
Not at this time, no. There are some certifications available, but our staff do not have those.
Well, that's good, because that means then that they know how to transition them back to the traditional path. They know both sides.
Exactly.
Okay, in terms of who can do it, is there an age restriction?
There is not. Any age span, is able to get into the water, young children up to, folks in their 90s.
Yeah.
And they're every day.
Like that movie Cocoon. I always think about that when I think of somebody getting in the water to heal themselves. So both at the North River Y and the Hamilton Place Y is where you find the aquatic therapy.
Yes.
If you're watching today and you just need a traditional route for physical therapy, they can help you there too, still at Hamilton Place, but Memorial North Park is where you would go. Okay, so go to memorial.org for more information, the phone number there on your screen, and you will be feeling better in no time. Becky, thank you.
Great, thanks, Julie.